Hello and welcome everyone to this webinar, the mega session for UK aspirants, which is a session from UK-based trainees to the UK aspirants. It's almost 10 o'clock here, so good morning all over the world from UK. This is the session which actually we all wanted to be a part of when we were starting our journey to the UK, but unfortunately it was all hit and trial for us because we didn't have the clear guidance during that time. Fortunately, you all have this session today from us so that you don't suffer like us to find the right information from right place. Disclaimer, by the way, we are not all perfect. Information changes every time. There's always some new update. So it's always better to read those information directly from official sources. And we'll signpost you to these sources throughout the entire session. So that's the session overview. We will start the session in next 1 minute now. We'll start with the UK basic introduction and pathways and criteria of GMC registration and talk about the IMG's perspective. So let's start first of all with a basic introduction about UK. It's officially known as United Kingdom of Great Britain and Northern Ireland. The capital city is London. Currency is not euro, but it's pound sterling. The international dialing code is +44. It's a small country with approximately 68 million people and just an area of 244,000 square kilometer, but the 6th largest economy of the world with a total GDP of 3.2 trillion US dollar. There are 4 constituent countries of UK, the England, Wales, Scotland, and Northern Ireland. But apart from these 4 constituent countries, we have 3 crown dependencies and 14 British overseas territories as well. 3 crown dependencies, namely Jersey, Guernsey, and Isle of Man. They are not sovereign state, but they are the territories for which UK is responsible. And the other 14 British overseas territories, they are sovereign state, internally self-governing, but UK is responsible for its defense and foreign relations. The regulatory council here is General Medical Council, like we have our own medical council back home. And the license to practice is required from General Medical Council to practice medicine in England, Wales, Scotland, and Northern Ireland. But apart from that, all 3 crown dependencies also wish their doctors working in their jurisdiction to be GMC licensed. And on the top of that, another British overseas territory, Gibraltar, specifically requires GMC license to practice for doctors as well. Let's now talk about what's the advantage of having GMC registration in other countries. So there's another country called Republic of Ireland, which is not the part of UK. It's not the Northern Ireland. It's the different state from Northern Ireland. It's the Republic of Ireland. So if you pass PLAB1 taken by GMC, then you'll be directly eligible to PRES Level 3 exam for their registration. So if you want to become registered and want to practice medicine in Republic of Ireland, you have to take PRES Level 1, PRES Level 2, and PRES Level 3. But if you have passed PLAB1 from GMC, you will directly be eligible for PRES Level 3 exam. The other country is Australia. If you successfully complete PLAB and a Foundation Year 1 training in UK, or if you've not done Foundation Year 1 training and have got 12 months of supervised practice in UK, then you will be allowed for registration into the Australian Medical Council directly via competent authority pathway. The other country is New Zealand. If you've got GMC license and you've got experience of practicing for at least 3 of the last 4 years, then it will allow registration via comparable health system pathway. If you've not got the GMC registration and don't have any experience of working in UK, then and if you have got PLAB1, then you'll be directly eligible for their clinical exam, New Zealand Registration Examination Clinical. Canada has got a different rule. I can't verify this information for other province or state in Canada, but if you talk about Alberta, which is a province in Canada, you can fast track your license directly and all the medical council qualifying exam will be waived if you are UK trained. This might not be very much relevant to you at this point of your time because you're not UK trained yet, but in future you can always explore the possibility of Canada as well. Likewise, a few other Middle East countries like Oman, Qatar, UAE, Saudi Arabia, will all accept GMC registration, but I have not verified this information independently. You can always check to their respective medical council's website and get more information on how to get registered into the Middle East countries after having GMC's registration. Now let's talk about how to become GMC registered. There are certain evidence you need to provide to the GMC to get registered to the GMC. The first one is the evidence of knowledge of your English. Second one is evidence of medical knowledge and skills. Then you also need evidence of primary source verification of primary medical qualification. That means your graduation certificate needs to be validated by your medical school, telling to the GMC that these are genuine medical certificates. You also need to provide the evidence of fitness to practice. So there are these 4 evidences that are required to get GMC registration. We'll talk about each of these evidence one by one so that you'll have more knowledge on how to get GMC registration quite easily. The first one is evidence of knowledge of English. And this evidence is not provided by how well you speak English, or if you've done your medical schooling in English, or if you've entirely studied in your school life in English. It's not by that way, but it's by a standard exam called IELTS or OET. Yeah. However, having said that, there is also the third way to evidence the knowledge of English, and that's by your graduation certificate from acceptable institution. So there is list of acceptable institution in GMC's website, and you need to be from a country with English as a first or native language in order to provide that as evidence for your knowledge of English. We'll not talk about this third category, but we'll talk about the IELTS and OET, because the third category, I believe, is not relevant to most of us because we are not from a country with English as a first or native language. Let's talk about IELTS first. Very briefly, there are 2 versions of IELTS, general training and academic version. And please don't take general training version, because if you take that at the end, GMC will not identify or accept that. You have to take the academic version. There are 4 domains: listening, reading, writing, and speaking. And you need to score minimum 7 in each band with overall score of 7.5. And this has to be taken all in same setting. This is important because there is another medical council called Nursing and Midwifery Council in UK, which will not require you to attain the required band in all same sitting. You can club the 2 different sitting as well and use that required band to provide your evidence of knowledge of English. But for medical registration, it has to be all in same sitting. It's different from the nursing registration here in UK. The validity of the certificate is 2 years, and you have to have at least £185 to register for this exam. Preparation time is generally 2 months. People take less than 2 months. Some people take more than 2 months. Generally, it's 2 months preparation time for IELTS. There are certain pros and cons of IELTS as well. It's slightly cheaper than OET. You've got more testing centers all over the world, which means you'll easily get the date you want. And since there are a lot of other universities also accepting IELTS, so it can always be useful for other purposes as well, not just for GMC registration. You'll always get faster result if you take IELTS than OET. You can get 3 to 5. You can get result in 3 to 5 days if you take that exam on computer, and you can take that. You can get the result in 13 days if you take that exam on paper. But the cons is generic form of English test. It's not occupation specific, so many people don't like that, and it's slightly difficult to pass. It's not based on my experience. I've not taken IELTS in my exam in my evidence. But many candidates say that it's difficult to pass the writing band of IELTS exam. The next evidence that you can provide to evidence your knowledge of English is OET, which stands for Occupational English Test. There are 12 different categories, and please select medicine version. Yeah. There are 4 bands like IELTS. It's listening, reading, writing, and speaking again. And you'll get score in 2 different formats. One is numeric score and the letter grade. You have to score at least B in each band or 350 numeric score in each band. And again, it's all in same sitting. Validity period is same 2 years. It's slightly expensive, Australian dollar 587, which approximately is 320 to 340 pounds on conversion. Preparation time is again generally 2 months. Pros and cons of OET is that the pros is that it's a specialty or occupation specific English test. So you'll have more familiar questions there. It's easier to score B in writing part of OET than 7.0 in IELTS writing part. Some of the preparation material in OET will also help in improving your interpersonal skill in PLAB2 exam, which is another added advantage of taking OET. But the disadvantage is that there are less testing centers all over the world, as a result, less easily available dates. You'll also get results slightly slowly. It's 12 working days and it's slightly expensive than IELTS. The second evidence required for GMC registration is evidence of medical knowledge and skills. And you can show this evidence of your medical knowledge and skill in different way. You can either take PLAB exam. There's a double asterisk mark there, which means that it's going to change very soon. And we will talk about that change as well. But if you take that PLAB route, you also need to provide the evidence of acceptable internship. And we'll talk about what is acceptable internship later. You can also show your evidence of medical knowledge and skill from postgraduate qualification. And this does not mean that the MD or MS from your home country will be used as an evidence. There are separate list of acceptable postgraduate qualification, which we will discuss later. You can also evidence your medical knowledge and skills by gaining a sponsorship from approved sponsor, or also by overseas registration exam. This might be less relevant nowadays, but we'll talk about what exactly is this route. So if you've taken USMLE, AMC or MCCQE exam of either US, Australia or Canada, and if you've passed that exam before March 2020, you can use that as an evidence for the GMC registration as well, and you can bypass the PLAB route. Like I said, the PLAB exam is going to change next year into the medical licensing assessment exam. And we'll talk about that briefly later. Let's talk about PLAB exam, which is the Professional Linguistic Assessment Board exam, and it's the most common route to evidence your medical knowledge and skills. There are two parts of PLAB, PLAB1 and PLAB2. And to take PLAB1, you have to pass in OET or IELTS. And to take PLAB2, you have to pass your PLAB1. PLAB2 must be passed within 2 years of application to register, so bear that in mind as well. Talking about the pass rate, PLAB1 has got slightly higher pass rate, 72%. And if you have studied from Nepal, I've kept Nepal here because most of the participants here are from Nepal today. So if you passed your medical studies from Nepal, it's slightly less likely you'll pass PLAB1. The statistics says that 70.3% of the doctors who studied in Nepal pass PLAB1. And in comparison, PLAB2 is slightly more difficult exam. It's only 61.8% PLAB pass rate. And the statistics from Nepal and Pakistan is comparable here. 54.9% of the doctors who studied in Nepal or Pakistan pass PLAB2. The statistics also says that female pass PLAB2 more than male. And there are other stats you can always check on the PLAB annual report directly from GMC's website as well. Let's talk briefly now about what is PLAB1 exam. It's a 180 single-based answer type multiple choice questions, and it's not 4 option, but it's 5 option here. It's a 3-hour long exam. Each question starts with a short scenario followed by a question, and the question will relate to the current best practice in UK. Now bear that in mind, because sometimes you feel that the answer should be something else, but it's not, because the way things are practiced in UK might be slightly different than what you used to practice in your home country. That's why the knowledge of NICE guidelines, SIGN guidelines, Royal College guidelines are always handy to pass these exams. This will test your ability to apply your knowledge for the care of patient. Yeah, and it does not test how well you can remember and recite the facts. So that's the sample answer sheet for PLAB1 exam. So as you can see, you have to use pencil, preferably 2B pencil, and you have to mark like this. The upcoming date for PLAB1 in 2023 is on 16th of February, 25th of May, 10th of August, 2nd of November. Check on the GMC's website which date is available to register. You can take PLAB1 either in UK or outside UK. If you are taking this exam on UK, you can take it on Belfast, Cardiff, London, Manchester, Edinburgh, Newcastle, and Sheffield. However, it's difficult to get visa for PLAB1. Most likely the visa will be rejected, and the explanation will be given that you can take this exam also overseas, so it's not actually required for you to come to UK to take this exam. So most likely your visa will be rejected if you take that in UK, if you decide to take that in UK. So that's why the overseas centers knowledge should be always handy here. You can take this exam either in Australia, Bangladesh, Canada, Egypt, Ghana, India, Kenya, Nigeria, Pakistan, Saudi Arabia, South Africa, Spain, Sri Lanka, Sudan, or UAE. India has got highest number of test centers, almost 6 test centers. And there is no Nepal as a center for BLAB1 exam. So we generally go to India, mostly in Kolkata, New Delhi. In my case, I took my exam on UAE in Dubai. And if it happens in Dubai, it's in the World Trade Center in Dubai. That's the sample question. So you'll have a short scenario followed by a question and a 5 option, and you have to select one of these options. Can anyone tell what's the right answer for this one? You can put your answer in the chat section. Let's see how many of you know about the proper ethical guidance and the legal guidance of UK. I've got a few answers there already. Yes, answer is A. Yeah. So let's not discuss this question because this is not the scope of the today's session. So the resource you use is either NICE Guidelines or NICE Clinical Knowledge Series. It's difficult to access NICE Clinical Knowledge Series from outside UK, but you can also use NICE Guidelines directly. The other book that you can use is Oxford Handbook of Clinical Medicine and Clinical Specialties. You can download the PLAB blueprint from GMC's website. PLAB blueprint is the curriculum for PLAB exam. You also need to study GMC's ethical guidance for doctors. You can get that from the GMC's website again. And there are a few online paid resources or question banks like PLABable, PLABverse, MedRevision. All this can be used on your preparation for PLAB1 as well. Preparation time, it depends quite a lot. Preparation time generally I would say is 3 to 6 months. Exam fee is £247, which is going to increase to £255 from April 2023, and result is generally published after 6 weeks. Maximum attempt to pass is 4. Another exam after PLAB1 is PLAB2, and it's an OSCE based exam. You'll have 16 OSCEs station that includes mock consultation or scenario of an acute ward. There will always be a patient information and instruction outside each room to read in 90 seconds. And after 90 seconds, you'll be asked to enter the room. Each station is 8 minutes long with warning bell at 6 minutes. And there will be 2 rest stations as well. So you'll have altogether 18 stations, 16 OSCE stations, 2 rest stations. The location is GMC Clinical Assessment Center in Manchester. If you can see in this photo, the candidates are lined outside these rooms. And there is instruction outside each room. You can read for 90 seconds and prepare yourself. At the end of 90 seconds, there is a bell. You enter inside the room and perform the mock consultation. There are different categories of PLAB2 station. It can be telephonic consultation. There will be no patient inside, just a patient information, a telephone, and you have to start the consultation directly on telephone. It can be SIM-man or a mannequin-based station as well, where you'll have a mannequin to perform examination or to perform all the other measures of your clinical examination. It can be examination-based station with a real patient. There can be history-based station or counseling-based station as well, where there will be a patient talking to you and you have to counsel, take history, manage, assess the case as well. So these are different categories you will be tested on in PLAB2 exam. Preparation courses, there are different academies in UK that can provide you the course materials and the preparation materials. Aspire, Samsung, Common Station are few to name. Exam fee is £906, which is going to increase to £934 from this April 2023. You'll be tested on 3 domains: your skill of gathering the data and assessment, your skill of management, and your interpersonal skills. And it will be marked across 10 skill areas. Each station has got 12 marks, and there will be a total of 192 marks, and you need to pass on total mark and also pass on the minimum number of station, which is 10 out of 16. So you need to pass 10 station and you need to also pass on total mark on that given day. Maximum number of attempt allowed is 4. So this is the sample instruction outside the cubicle that you'll be given. Like you'll be knowing where you are, you'll be knowing who the patient is. You'll also have other information if it's there. They will give you the task, like talk to the patient, assess the patient, discuss the plan of management. And sometimes there will be special note as well. So you can read and prepare for 90 seconds and perform in that 8 minutes inside the cubicle. So we're talking about acceptable internship pattern. So if you take PLAB route, you also need to provide the evidence of your acceptable internship. This means that your internship should be of minimum 12 months. You should not be absent for more than 20 days, apart from the annual leave, which can be up to 5 weeks in that 1 year time period. And your internship should contain at least 3 months in medicine and its allied subjects, and at least 3 months in surgery and its allied subjects. So be careful about that. And the evidence should be provided in a certificate form with the date of issue and the document confirming successful completion. So we're talking about postgraduate route as well. So if you've got these Royal College exams, you can also get GMC registration. Like for example, FRC Path for pathologists, MRCS for surgeons, MRCP for physicians, MRChem for emergency medicine, MRCOG for obstetricians and gynecologists, FRC Opt for ophthalmologists. So there are these postgraduate route as well. If you have taken these exam, you can bypass PLAB route and get the GMC's registration as well. You can also get the GMC registration by the sponsored route as well, which is like programs like MTI program, ICFP program. There are other list of 10 to 15 different program in UK where you can get GMC's registration from that approved sponsor route. And the full list is there in the GMC's website. We'll talk about MTI program later by a MTI trainee. We also talked initially about the overseas medical registration exam, and I also told that it's less relevant nowadays because this was there when there was COVID and GMC was not able to give PLAB2 exam. So if you have passed any of these in less than 4 attempts, then you can use that as an evidence to get GMC registration. Like for example, if you've passed in less than 4 attempts, USMLE step 1, step 2, CK, and step 2 CS. And if you've passed step 2 CS on or before 13th of March 2020, then you can use that as an evidence. If you've taken Canada's Medical Council Canada qualification exam, part 1 and part 2, and if you've passed them before 27th of October 2020, or if you've taken AMC CAT MCQ and clinical examination before 5th March 2020, then in that case you can use these exam pass certificate as one of the way to evidence your medical knowledge and skill as well. Now this came into effect after the COVID, during the time of COVID, when GMC was not able to deliver its own PLAB exam, and that's why there is that cutoff date. So today we are already on 2023, so less relevant to most of you. You'll also need to provide consultant report that you are on medical practice for 3 out of last 5 years, including 6 out of last 12 months, if you want to go through this route. And if you have failed PLAB before or after passing overseas exam, then you are not eligible again. There is this future update. The PLAB is going to change to medical licensing assessment from 2024. So instead of PLAB1 and PLAB2, you'll have AKT and CPSA. AKT stands for Applied Knowledge Test, and CPSA stands for Clinical and Professional Skills Assessment. AKT will be similar to PLAB1 and CPSA will be similar to PLAB2. So your preparation might not change fundamentally. The curriculum at the moment is PLAB Blueprint, but you'll have the separate curriculum MLA content map that will replace the PLAB Blueprint very soon. However, if you have passed PLAB, it will still be valid. And if you have passed PLAB1 and yet to take PLAB2, then you can take CPSA rather than PLAB2 as well. And that will start from 2024. Apart from evidence of knowledge of English and evidence of knowledge of medical skills, you'll also need to provide the evidence of primary source verification of your primary medical qualification. So this means that your graduation certificate should be verified. It should be in allopathic medicine, and you should have done clinical rotations as a part of it, and it should be awarded by an institution listed in World Directory of Medical Schools. So this PMQ should be primary source verified, which means the institution who provided it should verify that this is a genuine certificate. And this is done by Educational Commission for Foreign Medical Graduates, ECFMG, which is based in USA. You'll use the EPIC portal, which stands for Electronic Portfolio of International Credentials. You'll use this online portal where whole verification process is done. The whole process summary is that, first of all, you need to create an EPIC account. You need to upload your photo and passport copy. You need to pay $130, and then you will get an EPIC identification form after that. You'll have to verify this EPIC identification form with the notary service, and they use NotaryCam as the online notary service. This is done via live video chat. And the fee of this notary verification is included already in your EPIC account, $130. You need to upload your primary medical qualification and then pay another $100. And you need to choose the method to send this primary medical qualification to your institution, either online or via courier service. If you do online, it's free, but if you choose courier service, you have to pay $30. And you have to choose GMC as the recipient of the report after verification. And you also need to go to your medical school and inform about this EPIC request that will be upcoming. The institute might charge separately for this again. Once the whole process is completed, ECFMG will directly send the report to the GMC automatically. You don't need to tell them. The whole process might take like almost 3 months, so be careful to do it as early as possible. The next evidence is the evidence of fitness to practice, and you need to declare to the GMC that you don't have any serious health conditions, you don't have any cautions and convictions, fixed penalty notice, any actions taken by your regulatory body or medical school, and there are no clinical negligence and medical negligence claims against you. For this, you need to submit the good standing certificate from all the regulatory bodies that you were registered to within last 5 years, that is dated within last 3 months. And this means that even if you have not practiced in that country, but you were registered in that country in last 5 years, you still need to provide them the good standing certificate from that medical council. Let's talk briefly about the training pathways in UK. So I will talk about how it works for UK graduates, and I'll try to put the IMG's perspective into it. So the UK graduate, first of all, they complete their MBBS at a UK university, and they will get the GMC provisional registration, like the way you get the provisional registration back home. So once they get the GMC provisional registration, they will start their foundation year program, which is of 2 years, FY1 and FY2, and this is run by UK Foundation Program Office, UK FPO. Once you complete this 1 year FY1 program, you will get a certificate of experience, and you will use this certificate of experience to get GMC's full registration. And once you get full registration, you will start your UK Foundation Program Office Foundation Year 2 program. And once you complete this FY2 program, depending on your specialty, you will either join a run-through training or uncoupled training. In run-through training, you'll have one recruitment, and once you get recruited, you will end up completing that training and becoming a consultant. So once you start specialty training, it will be ST1, ST2, ST3, ST4, ST5, ST6 as well. And then you'll complete that training and you'll get certificate of completion of training or CCT to become consultant in UK. That's the run-through training program where recruitment only takes place once. But then there is uncoupled training as well, where you will be recruited twice. The first during your core training, which is CT1 or CT2. In case of internal medicine, it's IMT1, IMT2, and IMT3. So this is core training. Once you complete core training, you'll apply for specialty training and you have to be recruited again. And you'll start your ST3 or ST4, depending on whether you are on IMT or other core training program. And once you complete your specialty training, you'll get the completion of training certificate and you'll be able to be registered as a consultant in UK. So these are the list of run-through training and uncoupled training. Like for example, GP is run-through training, and radiology is also run-through training. Most of the other training are uncoupled. So where you have to complete core level training followed by specialty training. So you can always go through this list on the Royal College websites as well. So how do the IMG fit into this training program? Because you've not done the UK Foundation Office program. So to be registered into the GMC and to train further in UK, so first of all, definitely you need full GMC registration. And after that, you will start a FY2 standalone training program by UK Foundation Program Office. And you will apply to the specialty application, either run through or uncoupled. So this is one way. So get full GMC registration and do only 1 year of FY2 level program, which is a standalone standard training program by UK Foundation Program Office. And we'll talk about more detail of FY2 standalone program later by one of the doctor who went through this route to get into the training program. The other route is to get full GMC registration and to start working in UK as a known trainee doctor, also known as trust grade doctor or a junior clinical fellow, FY2 or ST1 level. And then you get your CREST form signed, certificate of readiness to enter into specialty training. So this CREST form is signed by any consultant who you have worked with in last 3 months, in last 3.5 years. So once you get this CREST form, you can then go into the specialty application, either run through or uncoupled again. So this is your second way to fit into the training program in UK. And most of the candidates use this second route, where they work as a known trainee doctor for 6 months to 1 year or to 2 years, get their CREST form signed and apply into the training program. Third way is to get full GMC registration and start in a registrar level directly as a known trainee registrar, also known as specialty registrar or senior clinical fellow at the level of ST3+, and get your alternative core competencies signed. It's like a CREST form, but you are not getting foundation competencies, but the core training competencies there, signed by the UK-based consultant. You also need your full MRCP or relevant Royal College exam, and then you apply directly to the ST4 training. Sometimes you can bypass everything and you can directly get the Caesar support. Okay, so this is another way where by working as a known trainee registrar or SHO, you can still become consultant, but that's from the Caesar route, which is a bit difficult, and you know your trust need to support you for Caesar route. So that's all about the pathways and criteria for GMC registration. We'll open the floor to the question now. You can type your question on the chat section or directly turn on your mic. We'll have 5 minutes for question and answer.
Hello, sir.
Yes.
Sir, if we clear Royal College exam like MRCS, then where do we fit in this training? Like we clear both the part of MRCS and then we want to get GMC registration, then where do we fit in this pathway?
So you're talking about working as a non-training doctor in UK or a training program in UK?
Sir, like currently I have completed my internship, and after that I'm asking like after we clear our MRCS, and then can we join non-training pathway, and then thereafter we can continue with the training. Is that possible?
Yes, it is possible, but I would like to give my sincere recommendation to everyone. Please do not directly join into the training program. Things might run slightly different in UK. Yeah, your standard way of practice might not be the same in UK. So it's always better to know the UK system. If you work as a non-trainee doctor here for 1 year, 1.5 years, 2 years, you will know UK system better. You will get your CREST competencies signed from a UK-based consultant, and it's always safe to do that, because if you do the non-training job here, you'll be well supported. You'll have a lot of shadow period. You'll not be placed on on-call rota immediately. So all these are advantages. If you are starting as a training in UK, your first day might be an on-call shift as well. So it's going to be difficult for you. So if you have done the Royal College qualification from your home country, get GMC registration like the way we said, and then work in UK as a non-trainee doctor for certain duration of time, get your CREST form signed and apply to the specialty program. Yes, next question, please. Someone asked me about how hard is it to get non-training job in UK. We'll talk about non-training job application in the next section now, which is going to start in a while. Yes, so is it possible to get GMC registration via MRCS, MRCOG route without PLAB? Like we said, there are different ways to evidence your medical knowledge and skills. One of the way is PLAB, the other way is acceptable Royal College qualification. And yes, using the postgraduate qualification, Royal College qualification, you can get the GMC registration. Someone asked, is there any F3, F4 program? Yes, there is Foundation Year 3, Foundation Year 4 program, but these are all informal program, non-training program, like any other non-training job. Can you please elaborate on CREST form and requirements? Well, this is the next section. We'll talk about that in the next section, which is going to start very soon. So CREST form will be discussed in detail in that section. How long should we work as a non-training to get CREST form signed? So we'll answer that question in the next section. So what subjects include in surgery and allied subjects? Please check your GMC's website regarding the acceptable internship pattern. Orthopedics, anesthesia are all the part of surgery. When would be the best time to get verified through EPIC portal during PLAB journey? I would recommend after completing PLAB1. Okay, so I think we've done most of the question. We will start the next section now.